to the special report of the MEV1, the Dateline and Aftermath. I am your host, Anna Grant, and joining me tonight is Dr. Ellis Cheever, head of the CDC. Good evening, Doctor. Our viewers tonight would like to know, what exactly is MEV1?
First of all, MEV1 is a chimeric virus, which is a genetic mix of a bat virus and a domestic pig virus that infects both the lungs and the brain. It is highly infectious and is transmitted via fomites, or objects touched by infected individuals. Its symptoms include hacking coughs, fever, a severe headache, which will be followed by a seizure, and brain hemorrhage, which will finally lead to death. Due to an unusual incubation period, MEV1 kills an infected person within hours of the exhibition of symptoms, which happens around 4 days after infection.
So basically, it's an incredibly deadly virus that can be spread through any form of physical contact and even to an extent airborne?
Exactly. It was hard to report an exact number of cases since the disease spread out so fast and with cases dying as the symptoms began. Overall, there had been 26 million deaths worldwide.
That's quite a number. If I remember right, the last time an outbreak of this magnitude was during 1918, during the Spanish flu, which killed 20% of the population. And so now we're seeing a repeat of history now with MEV1, which will also hopefully be resolved. In the course of MEV1, when we still didn't have a vaccine for it, there were people who were actually immune to it?
Yes. There were rare cases of immunity of the disease. One of these, 1 in a million people, was in fact Mitch M. Ermhoff from Minneapolis.
Interesting. To give our viewers a perspective of the disease, let's show the timeline of the disease.
News spread worldwide of a new virus called MEV1 in the past year. This is a virus that took so many lives in such a short amount of time. CDC released a report of their investigation into the origins of the disease due to public demand. In the report, they explained that a Miss Elizabeth M. Hoff was labeled Patient Zero during the initial stages of the outbreak. Through their investigation, they were able to link a few other cases to Miss M. Hoff. She had gone to Macau on a business trip. Videos of her visit had been released to the press unofficially. The CDC claims that there had been an earlier case, however, that is the chef of the restaurant. First contact with the disease was when the chef was preparing an infected pig. During the visit, she had also made contact with a Ukrainian model and a distinguished Chinese businessman. On her way back to Minneapolis, she reportedly stopped over in Chicago to visit an old friend, Mr. John Neal. She then died of the disease hours later in a hospital in Minneapolis. The others whom she had contact with had also died in similar fashions. Even the waiter, based in Hong Kong, who merely handled her glass of wine in Macau, was reportedly exhibiting symptoms before meeting his demise in a road accident. Cases were suddenly spreading in Macau, Minneapolis, China, Europe, Chicago, and Hong Kong not long after that. As the CDC put it, the infection, which spread globally and took countless lives, began when somewhere in the world, the wrong bat met up with the wrong pig.
To make things worse, the blogger, Alan Crowley, kept advocating the use of the drug forsythia. The drug was sold in pharmacies. Rampant looting soon became evident, and as you can see, social order gradually waned in places around the globe. Fear of getting the disease spread like wildfire, even faster than the disease itself.
I see. So on the molecular level, reassortment of bat viruses and domestic pig viruses caused the emergence of MEV1. On the individual level, indiscriminate touching of people, surfaces, objects, and other things infected by MEV1 contributed to the spreading of the disease. And on the social level, are living in communities with shared amenities such as water, public transportation, and goods, as well as our constant interaction with other people led to the eventual global pandemic.
This is why the CDC had to act fast. Measures such as reminding people not to touch, quarantining suspected cases, blocking off roads, and isolating infected communities were used to reduce further infections, while at the same time, Dr. Ali Hextall researched on the method and finally came up with a cure.
And here on the line we have Dr. Ali Hextall of the CDC, the reason behind the cure. Good evening, Dr. Hextall.
Well, it wasn't easy, I give you that much. First, we had to obtain a live sample of the virus that would be attenuated to be able to develop a vaccine. This was difficult because the nature of the disease made it such that those who were found to be infected died almost instantaneously, making it difficult to get live samples. Research was done to identify and grow the virus involved by getting samples from dead bodies. After succeeding in growing the MEV1 virus in a laboratory setting with the help of Dr. Ian Sussman, the virus was then grown in culture, after which they were tested for different types of vaccines. After much research and trials, an MEV1 vaccine was finally developed. Marshall and I did self-inoculation to determine the health effects of the vaccine and how to cure them. Also, Dr. Ellis Shiva and I had to fight off placebos, which we are still in the process of suing, such as that of Alan Crumley, the blogger, that supposedly cure MEV1. His cure was a homeopathic remedy based on forsythia, but it may not be a very good idea to rely on this because continuous demand for it causes healthy people and infected people to congregate, increasing the susceptibility of the public to the disease. All in all, we managed to solve and ration out the medicine through a random lottery based on birth dates for 1 year, until all survivors are vaccinated. More of the vaccines are currently in production and will be ready to ship out in a few days' time.
Thank you so much, Doctor. And that was Dr. Ali Hextall on the line. Going back to Dr. Ellis Shiva, what were the results of this vaccine?
Well, first off, it has been very successful in preventing further outbreak of the disease. However, due to its late discovery, it was not able to prevent the decay of social order in communities.
Anything else?
First, I would like to apologize for not finding the cure faster than we could. Also, I'd have to admit that our preventive measures were insufficient because this was the first time in recent history that a scare worse than a Spanish flu has been faced. We could have tried to control the blogger Krum Widmore by limiting his information sphere. We also could have sent more than just one epidemiologist to do data gathering and assess the situation. Also, we should have regulated the food much earlier to prevent looting and decay of social order. And aside from that, we would also like to add more relevant information regarding the issue. Earlier, one of our CDC agents explained how the speed of infection can be measured through the R0, which refers to the number of persons who will become sick after coming into contact with an infected individual. But what we didn't specify was the other important part, which is how long it takes for it to go from one person to another. That is the generation time. So those are the two key numbers in facing an epidemic, the R0 and the generation time.
And that was the news for our special edition of the MEV1, the Dateline and Aftermath. I'm your host, Anna Grant, signing out.